Last week received the approval from an EUA approval for our Veritor platform for the COVID-19 testing. This is an immunoassay which allows a very rapid test in low complexity environments like doctors' offices, hospitals, urgent care facilities, etc., to do a test within 15 minutes. And when we say 15 minutes, it's really from starting, taking the sample to get the answer.
And how does it work?
Well, this is a so-called immunoassay, an antigen test. So the way it works, actually, it detects an antigen in the sample, looking for a signature of the virus.
All over our country right now, we are hearing about sort of a nationwide supply shortage of the basic coronavirus tests. Yeah. And even myself personally, I've noticed the change. Like, I had to be tested for it in May, and the results took 2 days to come back, which even the 2 days was not ideal. I was tested last week, and the results took a full 7 days to come back. So it's taking longer and longer to get the results back. Can you talk a little bit about how this can really kind of be maybe a little bit of a game changer here?
Yeah, this is why we think this antigen test is a real game changer. You get the result within 15 minutes at the point of testing. It's a point of care test. Versus in current circumstances where you get a nasal swab or nasopharyngeal swab, and it's sent to a central laboratory and you have to wait for the results. It takes up to 4 days, and in some cases even up to a week, if you from the moment you get a test done until you get the test report. And the reason for that is that the sample is sent into a central lab. It's analyzed there with a so-called molecular test. It's usually a high throughput, higher complexity test that needs to be performed by a lab technician on a very dedicated instrument. Versus in case of the antigen test, you have a very simple cell phone-sized device, and it's allowed to operate in so-called clear wave environments, low complex environments, doctors' offices, hospitals, urgent care facilities, etc. Where nurse basically can take the test, and it's very similar to the flu test. So if you had a flu test before, it's exactly the same procedure. In our case, it's a very simple 4-step workflow. So you will receive a kit which contains a swab, a vial with some reagents, a cartridge that is used to analyze, and you have to have the reader, of course. So what you do is you take a nasal swab, you dip it into the vial, stir it a couple of times, take it out, flip the so-called dropper tip on the vial, turn it around, drip it on the cartridge, wait for 15 minutes, plug it into the reader, and within the next 10 seconds, you will see whether you are COVID infected or not.
Amazing, absolutely amazing. I realized that you just got that emergency use authorization.
Yes.
From the FDA last week. So I realized we may not get it overnight, but how soon do you think we could see this become available in possibly the Sacramento area, or at least the Northern California area? Do you have any insight on that?
Yes, absolutely. Look, the good thing is we have a large installed base of these readers across the United States. Actually, we have more than 25,000 readers across 50 states in the United States. In California, I think it's more than 1,800 of these instruments that are out there already. And we already started manufacturing the test kits. So this week we start shipments of the kits. We are, of course, still in the ramp up of manufacturing these kits. We call it scale up. We plan to ship and sell about 10 million tests from July to September. And scaling means we start manufacturing this week and have the first shipments. And by end of September, we will be able to manufacture about 2 million tests per week.
2 million per week?
Per week, by end of September, yes.
That is incredible. So incredible. Wow. And then have you, since you did get that FDA EAU, has your company just kind of been blowing up with phone calls from healthcare providers from across the country?
Of course, yes. There's a lot of excitement out there about this test, right? Given its unique value proposition, again, it's fast turnaround. It's a rather cheap test. The readers itself are very cheap. It costs a couple of $100 in the range of $300, the reader itself. So it's very affordable for doctors' offices, urgent care facilities, etc. And again, it will address one of the most urgent needs in healthcare right now, which means you want to identify infected patients as quickly as possible, so you are able to start a right treatment, but also you're able to isolate and also do tracing of start tracing of whom they had contact with. We have to break the infection chain. That's I mean, everybody agrees that's the recipe until we have a vaccination out there. Otherwise, the virus will continue to spread, and we think our new test will definitely help to address that need.
Okay, and then I think you said it, but I just wanted to clarify the pricing of each of these tests. What is that again?
Well, the pricing, in terms of price, we can only talk, and we talked about it also in investor calls. We sell it in a range of $20, right? What it will cost the patient actually depends on his insurance, on the reimbursement, etc., on copay, etc. But I would think about it in a similar range like the flu test, because it's a very similar test.
Okay. And then let's see here with, let's see, is there, would someone have to go to like an urgent care clinic to get this done, or a hospital, or just your basic primary care doctor to get this done? Where can someone physically go get this test in California?
So again, in California, it's, as you said, it's available in several doctors' offices and in urgent care facilities, in some retail clinics. These are the typical use cases for this test.
And the headline of this, it's so exciting to hear that you can get your results in just 15 minutes. So yes, it's fast, but the number one question we hear from people is, does it work? Is it actually accurate? What can you tell us about the accuracy of these tests?
Well, the accuracy is very similar in terms of, if you took a look at the performance, and accuracy is one vector of performance. It's very similar to a flu test or a strep test that you get during the winter. This is again a lateral flow immunoassay test. Our tests and our clinical studies have shown, and by the way, we did clinical studies across 21 different sites in the US, across the US. We collected more than 220 samples, and you can read this also in the instruction of use within the manual of the test. Very comprehensive study, because that's what you need to do to get FDA EUA approval for this test. These tests have shown us that we have 100% specificity and about 84% sensitivity. Now, what does this mean? Specificity actually is a measure of if the patient is COVID negative, does your test say you're COVID negative? And we say yes to 100%. If your patient is positive, does your test also say it's positive? In this case, we say to 84% is the sensitivity level we have measured. Now, what does this mean in practical use? Let's say you have about 100 patients, and they walk up into 100 patients who walk into a clinic, have symptoms. And this has been demonstrated with our clinical testing. Out of 100 patients, we probably saw an infection rate of 10%. So 10 out of the 100 had a coronavirus. So 90 were COVID negative. And out of these 90, our test would identify exactly that these 90 are negative to 100% specificity. The remaining 10 who are positive in that case, between 8 and 9, so 84%, we would confirm positive very quickly. And that's a big difference. So a way to look at it, out of 100 patients you have tested, 98 to 99 come back with the correct result. And that's a very good result for tests like this.
So it does sound like it is fairly accurate then.
It is, yeah. Again, compared to very well adopted tests like flu tests or strep A tests.
Okay, and then let's see here. Are there any other key takeaways that you want to let people know about this? I feel like we heard maybe a little bit of skepticism from one of our doctors that we use as a medical
Mhm.
expert, saying like, you know, we ran into some issues with rapid testing in the very beginning of this pandemic, and she said those rapid tests, while I realized that they were a different type of test,
It was a completely
those,
different type of test, yes.
yes,
Yeah.
they were different types, but they kind of failed because their
Mhm.
accuracy level wasn't so
Yeah.
good. So what, with that being said, any kind of reassurance with this rapid test, like, hey, different type of test and this is way better?
Yeah. So I think the reassurance we can give you, number one, is it's based on very proven technology, right? It's used in similar other tests like flu testing, flu A/B. We have a test out for that. We have strep A out as a test. We have RSV out there as a test since many years. It's a similar test. What you have to have, of course, is different antibodies you test again. And we have, in our studies, until we got to this test, we tested more than 100 different antibodies to make sure that we get the most sensitive and the most robust antibodies out there to put on these test strips. We also have done a very comprehensive clinical validation study before we launched this test. And again, we went across 21 different sites in the United States that collected samples. And out of these samples, we could confirm that we have 100% specificity and about 84% sensitivity.
Anything else that you would like to add that you think we may have missed?
Well, I think what is really unique about our test is, and our instrument itself is, it's highly portable. It's actually battery operated with rechargeable batteries. It's about the size of a cell phone, so very mobile. So think about it, you can basically use it in any kind of outpatient or long-term facility. Again, the turnaround time, we talked about it, 15 minutes, very unique. And we would also claim that we have the simplest workflow. It's a simple 4-step workflow that can be done by nurses, and they use it because they perform these tests with flu tests and other tests.
Do you think that these type of rapid antigen tests, do you think these could end up replacing the common test that we've been dealing with, these long delays? Do you think that these could end up replacing the test that we've been talking about for the past few months?
I think it is very complementary, to be honest. And I think where this test is used, again, is for symptomatic patients to get a very fast answer. Of course, the PCR testing has a different detection methodology, so it can detect even lower levels of viruses, even for asymptomatic patients, etc. So there's I would say, very good coexistence with both tests. Moving forward, as we go into the next flu season, I think these tests will most likely, and we're working on this as well, be complemented by tests that can do both flu as well as COVID-19, because that will be the big question when we enter the flu season. When you walk into a doctor's office, you want to know, do I have the flu or do I have COVID-19? And we will look into opportunities to have a combined test, similar to what we do today in COVID-19.
We briefly touched on this, but is this covered by insurance or not yet because it's so new?
Well, it's very new, right? But the AMA, the American Medical Association, I think just last week or 2 weeks ago, adopted a code for this new to report these new antigen testing of patients who are suspected to have COVID-19. So that is in place. And again, it will depend on the coverage of your provider, how much you will reimburse, how much is copay, etc. But we expect it to be in the same range or in the same modality like a flu test.